Sapna, one of your mentors at Study Medic, and we are back with our RRR series, which is a series that we cover very important topics in a short duration just before the exam, so that when you're preparing in your final days and you don't feel like reading anymore, you can always tune into the YouTube channel and look for the informative snippets on the high yield topics. So my topic for today would be a very interesting topic in embryology, which is the pharyngeal apparatus, which like all of you know, pharyngeal apparatus will be consisting of the pharyngeal arches, the pharyngeal pouches, and the pharyngeal clefts. Okay, so these in entirety form the pharyngeal apparatus, and all of them, as we know, will have their own arteries. So let us try and decode and demystify what this pharyngeal apparatus is, so that this arch enemy becomes your true friend in the exam. And believe me, it's going to be very interesting. And let's move on and see what's more to it. And we always begin with a quote, and our quote for today is: always believe that something wonderful is about to happen, which is about to happen soon. You're all going to sit for your exam and come out with flying colors, and it's going to be wonderful. Okay, and so is it for embryology. Okay, a little small zygote, and it's like nothing in the beginning, and then in a few months it becomes a beautiful you. Okay, and me, of course, but that's how wonderful nature is. All right, so this is what embryo looks like when it's around 5 weeks, so around 25 days. So as you can see, there is a cranial end. Okay, there is a pericardial bulge, and here is this gap. Okay, this gap is called the stomatium, and which will form the mouth. Okay, the adult or the future mouth. Now in an adult, as you see, there's a mouth and there's the heart, and there's an area in between. However, in this embryo there is no area in between for the tissues in between to develop, and this is where our pharyngeal arches come into play. Okay, so what happens is that, imagine that this is the gut tube. So in the center we have a gut tube which is made of endoderm. Okay, surrounding this is the mesoderm, and outside the mesoderm is the ectoderm. Okay, so the pharyngeal arches, okay, are nothing but proliferations of the mesoderm. It grows anterior, laterally anterior and downwards. Okay, and forms a typical bulged neck of the embryo that we know. Okay, this is the typical shape of the embryo that we've seen often, and so these are the mesodermal proliferations, and on the inside is the pouch, which is lined by the endoderm. So the endoderm is the pouch, and on the outside are the clefts, which are formed by the ectoderm. Okay, and as we know, each of these arches have their own muscle and cartilage due to the mesoderm. They also have, each one of them has their own nerve, which are cranial nerves, which are the neural crest have sent up cells. So each of these arches will be associated with a nerve and a blood vessel, an artery. Okay, so we're going to soon talk about it. So the pharyngeal apparatus, as we said, was the pouches, the mesoderm or the arches, and the clefts on the outside, each with its vessel, nerve, muscle, cartilage, and bone. Okay, so let's see how we can easily kind of remember it and tackle the exam questions. So this is just another image showing you all the pharyngeal arches, and these are the neural crest cells which are coming in. Okay, so these will give rise to the nerves of each of these arches. Okay, this is the ectoderm, this is the endoderm, these are the pouches, these are the clefts, and this is the mesoderm with this neural core. Okay, and let's see how it develops further. Okay, so now we're going to learn about the nerves of each of this arch. Okay, so pharyngeal arches. It reminds you of archery. Okay, so a bow and an arrow. Now, as we had learned earlier that there are 6 pharyngeal arches which are developing. However, the 5th arch either regresses completely or it starts to develop and then fails to develop. Okay, so the 5th arch is to be ignored. So in all we have 5 arches, that is number 1, 2, 3, 4 and 6. There is no number 5. Now when we see this, and like in statistics you've done medians. Okay, so what is the median here? Median is number 3. Okay, so this is a bow and arrow and this is its most important point. Okay, this is the pivot point and we will put our median number 3 here, and then this is how we label it. We put 2 in the middle, 1 at the corner, number 4 goes up and number 6 comes down. Okay, so the way to memorize these nerves will be like, if you have number 1, okay, so you add up the numbers which are right next to it, so 2 plus 3 and like so on and so forth, as we will see. So for the first arch we do 3 plus 2, which is 5, okay, which is the trigeminal nerve. Then for the second arch we do 3 plus 4, so that is 7, which is the facial nerve. For the third arch, okay, we will do 3 plus 6, which is 9, or the glossopharyngeal nerve. And for the 4th and 6th, what do we do? They are at each end of the arch, so we add them up. So 4 and 6 are number 10, or the vagus. Okay, so the 4th one is superior laryngeal and the 6th one, which is lower down, is recurrent laryngeal nerve. Okay, so this is how we do it. This is how I started to do it, but of course now I know it's 5, 7, 9 and 10. Okay, so quickly just remembering the nerves. So this, what we see here, are actually what is the development of the aortic arches. Okay, so the vessels of the upper body and the pharyngeal arches develops through what we call as the aortic arch. Okay, now let's just quickly or slowly actually go through the development of the aortic arches, so that by the end of it, this diagram, which is at the moment looking very confusing to a few of you, okay, would seem a lot easier. All right, now so we're going to discuss the development of aortic arches now, okay, which are actually the first arteries to develop in the embryo. Okay, so the first arteries to develop are the primitive aorta. Now I need you all to have a good sense of imagination. Okay, so this is the developing foregut. Okay, and then you have 2 primitive aorta, one on the right side and one on the left side. So this is what you're seeing from the lateral side. Okay, so you see the lateral side, so this is the anterior or the ventral aspect, and this is the posterior or the dorsal aspect, and this is the developing gut tube. Okay, so this is your primitive aorta. You have one on the right and one on the left side. Okay, and this over here, they are connected by the arch. Okay, so the arch of the, not the arch of the aorta as we know it, but these are the aortic arches. Okay, so we'll be discussing about the development now. And as we know, there are 5 pharyngeal arches. Each of these arches has its own artery, and how these arteries develop is what our topic of discussion is going to be now. So as I told you, on the right and the left side there are 2 primitive aortae, and anteriorly, okay, what happens is the right and the left side, okay, these will merge, okay, and they will join the developing heart. Okay, and these 2 will join, and this is known as the aortic sac. Okay, so this is the aortic sac, and this is nothing but the cranial end of the truncus arteriosus, and down here is the sinus venosus. Okay, now the aortic sac, from the aortic sac, which is nothing but the the ventral aorta which have merged together, okay, these are going to give out aortic arch arteries, or the pharyngeal arch arteries, or the aortic arches, and they are going to connect the ventral aorta to the dorsal aorta. Okay, so the aortic sac, which is nothing but the merged ventral aorta, okay, to the dorsal aorta. So there are going to be 5 aortic arches, and let's see how they develop. Alright, so moving on, this is what we were talking about. There's the right and the left dorsal aorta posteriorly, okay, and this is the sinus venosus, the truncus arteriosus, and the cranial end is the aortic sac, okay, which is nothing but the merged 2 sides of the ventral aorta, and these part of the ventral aorta, this is known as the aortic horns. Okay, so these are the aortic horns. Now, like I told you, there are going to be 5 aortic arches which are going to connect the right and the left aortic horns to the dorsal aorta. Okay, so this is how it develops. And when we talk about the vessels of the body, so which is your main vessel that comes to your mind is the aorta. Okay, so let's talk about the development of the aorta first, okay, and then we'll move on to the other vessels. So let's talk about the development of the aorta. Now, what we need to know is that the aorta is formed from the arch of the aorta, and the arch has 4 alphabets. A, R, C, H are 4 alphabets. Okay, so the 4th arch artery is what we are going to be concerned about now, and it will start from the left horn of the aortic sac, okay, then the 4th arch artery and a little bit of the dorsal aorta, the descending part of the dorsal aorta. Okay, so this is what we are going to consider as our arch of the aorta. Okay, so the arch of the aorta is going to form from the left horn of the aortic sac and the left 4th arch artery and a piece of the left dorsal artery. Okay, next, this arch of the aorta has got 3 branches, which is the left subclavian, the left common carotid, and the brachiocephalic artery. Okay, so let's talk about the brachiocephalic first. Now, the brachiocephalic artery has to go on the right side, so this right horn of the aortic sac is what will form the brachiocephalic artery. So the brachiocephalic artery, the contribution is the right horn of the aortic sac. Then coming to the carotids. Okay, so C, carotid, C is the 3rd alphabet of the alphabets. Okay, and so C for carotid. So all are carotids, the common carotid, the internal carotid, and the external carotid, they are all formed from the 3rd aortic arch. Okay, so do not get confused. There have been a lot of questions on the external carotid, and a lot of people have the confusion that it's from the 1st aortic arch, but no, it is not from the 1st aortic arch, it is from the 3rd aortic arch. And all the carotids, the common carotid, the internal carotid, and the external carotid. So the common carotid is actually formed from the proximal portion of the 3rd aortic arch, okay, and the continuation of this aortic arch and the upwards portion of the dorsal aorta, okay, is the internal carotid. And external carotid is actually formed from the budding, okay, a bud which has come out of this 3rd aortic arch, and this is going to give rise to your external carotid. Okay, this is going to be the same on the right and the left side. So let's discuss what is the contribution. So the proximal part of the 3rd aortic arch, this is going to be your common carotid. Okay, then the extension beyond this is your internal carotid. So the internal carotid is from the distal part of the 3rd aortic arch and the left dorsal aorta. Okay, and this little bud over here, this is your external carotid artery. Okay, so the common carotid is from the proximal part of the third arch artery, the distal part of the third arch artery, and the cranial part of the dorsal aorta is your internal carotid artery, and this is both on the right and the left side. And external carotid artery is often asked is a part of which arch, so it is your third arch artery only. Okay, so now let's talk about the development of the subclavian artery. So there are two subclavian arteries, as we know. There's a left and a right subclavian artery. So the left subclavian artery, as we had seen, is a branch of the arch of the aorta. Now on the left side there is this left seventh cervical intersegmental artery which is coming in, and there are various intersegmental arteries. So the seventh cervical intersegmental artery, okay, it is coming and joining this arch of the aorta, and this is what is going to form the subclavian artery on the left side. Now we need to know that on the right side there is no such development. Okay, so the arch of the aorta is only on the left side. So what has happened on the right side in the arch of the aorta, and where does this right subclavian artery come from? So the right subclavian artery, there is a right seventh cervical intersegmental artery which is coming and joining the right side dorsal aorta as well. Okay, but the entire right fourth arch artery and a part of the dorsal aorta and this right seventh intersegmental artery, this is what is going to give rise to the right subclavian artery. So whereas on the left side it is only the left seventh cervical intersegmental artery which is forming, on the right side it is the right fourth arch artery, fourth aortic arch, and then the dorsal aorta and the right side seventh cervical intersegmental artery. Now we are seeing that this is the developing heart, and we saw that the primitive aorta is actually looping around the gut tube, and from the gut tube what comes out? There are the lung buds which come out. Okay, so we know that the gut tube is developing and the buds or the tracheal buds or the respiratory buds are coming out of the anterior ventral aspect of the gut tube. Okay, so imagine that you have lung buds on both the sides, and now this sixth aortic arch, okay, this is going to give branch to the lung bud. Okay, so this is now going to become a part of the pulmonary circulation. This sixth aortic arch is going to become the pulmonary artery. Now on the right side, the distal part of the sixth aortic arch, it will regress. However, on the left side, this part of the distal part of the left sixth aortic arch is going to connect the pulmonary artery to the dorsal aorta, and this is a very famously asked question. And no prizes on getting this one right. This is your ductus arteriosus. So what is the ductus arteriosus formed of? It is the distal part of the left sixth arch artery. And what does it become after birth, after delivery? The postnatal derivative is ligamentum arteriosum. Okay, so which is joining the pulmonary artery to the dorsal aorta in the embryology. Now the first and the second aortic arch also regress. Okay, and sometimes they give rise to the vessels which are the vessels of the first and the second pharyngeal arches. Now pharyngeal arches number 1 and number 2 have specific names. The first pharyngeal arch is called the maxillary arch, and the second pharyngeal arch is called the hyoid arch. So the first aortic arch is going to give rise to the maxillary artery, and the second aortic arch is going to give rise to the stapedial or the hyoid artery. Okay, stapedial and the hyoid artery. And now we've done all the derivatives of all these aortic arches. So I hope now that this is not looking as confusing. This is actually a color coded diagram of what we've just discussed. Okay, so you have your third aortic arch on the right and the left side. Okay, so this light green is your proximal part of the third aortic arch, which is going to give rise to your common carotid, and it is going to continue upwards in the upward portion of the dorsal aorta on both sides as the internal carotid, and of course there's going to be a bud which is going to form your external carotid, and which is also going to arise from the third aortic arch. On the left side, the fourth aortic arch is going to form your arch of the aorta. Okay, and then it is going to the left seventh cervical intersegmental artery is going to join in and form the left subclavian artery, and then it is going to continue downwards as the dorsal aorta. Okay, and on the right side, this is going to be your right subclavian artery. Okay, so the right subclavian artery is the fourth aortic arch artery, a part of the dorsal aorta, and the right side seventh cervical intersegmental artery. Okay, and the vessel which is the dorsal aorta, which is distal to this subclavian, is going to regress. Okay, and only this left side dorsal aorta is going to persist, and this is going to be your descending aorta. And then what happens to the dorsal aorta portion between the third and the fourth aortic arch? This is called the ductus caroticus, or the carotid duct, which in the postnatal period will also regress, but this is the portion which is connecting the third and the fourth aortic arch. Okay, so this is just about the aortic arches, and just wanted to let you know how each vessel, each one of them, which is very important, is derived from the these aortic arches. Now, we were reading about the ductus arteriosus, and we know that the sixth pharyngeal arch, okay, the sixth pharyngeal arch, there was the lung bud. Okay, so there was the pulmonary artery, and the distal part was joining it to the this dorsal aorta. Okay, so this was what was the ductus arteriosus. Now, of course, in the postnatal period, this ductus arteriosus is obliterated. Okay, and if it persists, it's known as the patent ductus arteriosus, which is a abnormal form. Okay, now the inducers, okay, the inducers of closure of this ductus arteriosus can sometimes also go distally into this distal aorta, okay, or proximal portion also. Okay, so this is if it goes proximal or distal to the opening, okay, into the dorsal aorta, this is known as coarctation of aorta. Okay, so if it is going distal, it is post-ductal. Okay, so this is the ductus arteriosus, so this is post-ductal, and this is pre-ductal coarctation of aorta. Okay, so if the signals or the inducers of closure of ductus arteriosus also proceed distally into the dorsal aorta or the proximal part of the dorsal aorta, then it causes coarctation of aorta. Okay, so these are just clinical things that you should be aware of. So now what we just did was a schematic understanding of the aortic arch derivatives. Okay, it was my attempt to just make it a little simpler for all of you, and having gone through that, I hope that this little mnemonic of ours will make it easier for you for the exam. Okay, because in the exam, of course, remembering this which aortic arch and which derivative, etc. So this is how we remember it. First is me. Okay, I come first, me, my. Okay, so the first is part of the maxillary artery. Now second is S, alphabet S. Okay, so we have the stapedial artery, and also, like I told you, the second pharyngeal arch is called the hyoid arch, so it will give rise to your hyoid artery. Now third is the third alphabet of the alphabets, that is C. Okay, so all the carotids, the common carotid, the internal carotid and the external carotid, will be from the third aortic arch. Now coming to fourth, the fourth aortic arch. So number 4. Okay, so you have arch, ARCH. Okay, that has 4 alphabets. Then how many limbs do you have? You have 4 limbs. Okay, so your limb artery and also the arch of the aorta is going to come out of the fourth aortic arch. So on the left side you will have the aortic arch, and on the right side you will have the right subclavian artery. Okay, so that's your upper limb artery. So that is your fourth arch derivative. Fifth arch will be regressing, so there is no artery which is associated with it. And moving on to the sixth, so you write number 6 like this, and if you write it upside down and invert it, it becomes a P, and if you invert it, it becomes a D. So 6 arch will give rise to pulmonary artery, 6P, pulmonary artery, and 6 also becomes inverted, it becomes D. So on the left side it gives rise to your ductus arteriosus. So this is how you can easily remember the aortic arch vascular derivatives. Okay, so we've tried to remember the nerves of the pharyngeal arches and the derivatives of the aortic arch, which will be the arteries of the pharyngeal arches. Now let's move on and try and memorize the other derivatives of the pharyngeal arches. Now it is a little bit confusing, so you will have to take a leeway and twist your mnemonics in a way that you can remember. So this is how I find it easy, and I'm sharing it with you. So like we said, for the aortic arches also, the first arch is going to be M, it is going to be me, it is going to be my, it is M. Okay, so everything associated with the alphabet M. Excuse me. So the muscles of mastication, Meckel's cartilage, maxilla, the external acoustic meatus, the middle ear, the mastoid air cells, mylohyoid, and as we did, the maxillary artery and the trigeminal nerve, okay, which is the fifth nerve. So this is your first pharyngeal arch. Now moving on to the second, like we again did in the aortic arches, S. Okay, so the second is the S, and we did that it is the stapedial artery and the hyoid artery, because it is also called as the hyoid arch. Okay, and the facial nerve, or the seventh nerve, which is again the number alphabet S. Okay, then the other structures which come out of it are the stapes, the styloid, the stylohyoid, the stapedius, and all the muscles of smiling. Okay, so S is for smile and M was for mastication. Muscles of mastication are the first aortic arch, muscles of smiling are the second aortic arch. Okay, so then we come on to the third pharyngeal arch, which is again associated with the third alphabet, which is alphabet C. Okay, so we did the carotid arteries. Okay, the nerve was the glossopharyngeal nerve, so just little bit of I've taken a this thing glossopharyngeal instead of glossopharyngeal, because that's how G and C look similar to each other. So try and remember it like this. Okay, and then, so suppose you imagine yourself, you're in a party and something, and you're trying to be very formal. Okay, so when you try to be very formal and you drink, kind of in a stylish way, you get, and you see something, somebody noticing you, you kind of choke, you kind of choke on it. Okay, so
So you choke when you swallow stylishly, okay? So which is stylopharyngeus is the stylish part of it, and which is used for swallowing, okay? So stylopharyngeus for swallowing, that's how you remember the third pharyngeal arch derivative. The fourth, of course, is the arch of the aorta and the subclavian, okay? So subways are affordable, okay? So the subclavian is from the fourth aortic arch, and the arch, of course, has 4 alphabets, so the arch of the aorta is the fourth arch derivative, okay? Now parlor is super, okay? So if you go to a parlor, you look superb. All right, so P is for the parathyroid, okay, which is also a derivative of the fourth aortic arch. Then the laryngeal nerve, okay, the superior laryngeal nerve is from the fourth aortic arch, okay, a pharyngeal arch, and then from the sixth pharyngeal arch will be your recurrent laryngeal nerve, okay? So this is how you learn the derivatives of the pharyngeal arches, okay? Alright, so this over here is a table, okay, which has in an image based tabular form. It has given you an idea of all the derivatives of the pharyngeal apparatus, okay? So the derivatives of the pharyngeal pouches have been mentioned, and the derivatives of the ectodermal clefts, okay, or the pharyngeal folds have been also given. So the first pharyngeal cleft, okay, which will give rise to the external auditory meatus, and similarly what are the cranial and the aortic arch derivatives, those have been given to you. So having gone through the mnemonics, okay, I would definitely encourage, and I feel it is always better that if you make a table of your own, it will become easier for you to grasp it, and the retention becomes for a longer period, okay? So having gone through the kind of mnemonics that we've given you, make this table on your own, and you will be able to solve the questions a lot better now. And let's go through a few questions which have come in the exam earlier, and let's see how you'll be able to tackle them. Okay, so our next question is: a 7-week embryo is found to have persistence of the carotid duct. Persistence of this duct can lead to abnormal vascular communication between which of the following arch derivatives? So if you remember, when we were talking about the aortic arch derivatives, there was this carotid duct which was joining the third and the fourth aortic arches. So it was a portion of the dorsal aorta which was between the third and the fourth aortic arch, and it was normally regressing. If it doesn't regress, then it gives rise to an aberrant external carotid artery branch, okay? So the carotid duct in its embryological period represents communication between the third and the fourth aortic arches. So let's see what the options are. The third aortic arch was the carotid, and the fourth aortic arch was either the aortic arch, okay, or arch of the aorta, sorry, or the subclavian on the right side. So let's see the options. The common carotid artery, okay, and the subclavian artery. All right, yes, this is right. Okay, so the first option is our right answer. Let's see the others also. The internal carotid and the aortic arch, no, the internal carotid goes up. Okay, so this is actually between the common carotid and the subclavian or the arch of aorta. The external carotid and the pulmonary trunk, absolutely not. The right subclavian artery and the left pulmonary artery, also not. Okay, and the ductus arteriosus and brachiocephalic trunk, also not. So we were right in our first attempt. Okay, so here were your arteries, and this over here is your carotid duct. Okay, so this is the carotid going up, and this is your arch of aorta. So the dorsal aorta, which was connecting these two, was the carotid duct, and on the right side the common carotid, this is the internal carotid which is going up, and this is your developing subclavian. Okay, and here was your carotid duct. So this was the answer. So that's it from now, and here's wishing you all the very, very best in the upcoming exam. I hope this presentation was a little bit useful for you, and now when you go back and solve those questions on pharyngeal arches or aortic arches, you'll be able to solve them correctly, and you will be able to interpret whatever the question is asking with a lot more confidence and not be afraid of pharyngeal arches or the aortic arches anymore. So all the very best. The exam is not going to be very difficult. You're all very well prepared for it. So go and give it your best. Shine like superstars, and go in with a smile in your exam and come back happily laughing. Okay, we are really looking forward to hearing from all of you after your exam, and all the very best to all of you. Okay.